Heart rhythm could be bradycardic or tachycardic. In a bradycardic rhythm, the heartbeat is slow. So what do we call as bradycardia? When the heart rate is less than 50 is what we call as bradycardia. And when the heart rate is more than 120, we call it as tachycardia. Now bradycardia can be of many natures. Sometimes we say you have bradycardia but we don't need to do anything. Sometimes we say yes, you have bradycardia but you need a pacemaker. So this is how the importance is. How do we decide which person needs a pacemaker and which does not? Anybody who has symptoms will need a pacemaker. So what are the symptoms of bradycardia? The symptoms of bradycardia would be lethargy, weakness, inability to work or perform activities, and fainting out. So a person with bradycardia could have these vast range of symptoms. It is for us to decide which one will need a pacemaker. So there are some basic tests that we do for deciding that. We do a Holter monitoring, where a Holter which records ECG is applied to the body, which could be for 24 hours, which could be for 7 days. It keeps recording and telling us how the rhythm is going. There could be others where we find out that everything is not in order. Just based on the ECG, we decide that this patient will need a pacemaker. So bradycardia, many patients will need a pacemaker, some will not need a pacemaker. So who should be investigated? Anybody whose heart rate consistently is below 60 should be investigated for a bradycardia. What about tachycardia? Now, tachycardia above 120 continuously present is not a good sign, should be investigated. And the basic investigation again remain ECG, ultrasound of the heart, and Holter monitoring. Holter monitoring is monitoring the ECG rhythm for 24 hours or 7 days. In tachycardia, there can be multiple forms of tachycardia, which only a doctor could decide. It could be a very serious problem, or it could not be a serious problem which may need medicine. So there are multiple ways of treating it. Fortunately, every patient can be finally treated and cured and have a happy life after treatment of tachycardia. So this is also very safe kind of a situation that we treat them and they feel better and they can go home and lead a normal life. So this brings us to an area where we have to understand bradycardia and tachycardia are part of heart rhythm disorders.